The Department of Justice asking a federal appeals court to overturn a federal judge's ruling last month that lifted mask mandates on public transportation. And then there's this, a Pew Research poll showing a majority, 57% of Americans say masks should be required on planes and public transportation. 42% say travelers should not be required to wear a mask. Again, that conducted early May, again from Pew Research. Joining us now is former White House Coronavirus Task Force member and author of the new book, Silent Invasion, The Untold Story of the Trump Administration, COVID-19, and Preventing the Next Pandemic Before It's Too Late, Dr. Deborah Birx. Dr. Birx, good to see you, and thank you so much for coming on. We appreciate the time.
Thank you.
Absolutely. I want to jump to that. That appeal made news last evening. But talking about the mandates, there is this New York Times headline that just came out correlating with this topic matter, saying this: why masks work but mandates haven't. In a brief excerpt from it that reads, quote, in U.S. cities where mask use has been more common, COVID has spread at a similar rate as in mask-resistant cities. Mask mandates in schools also seem to have done little to reduce the spread. Hong Kong, despite almost universal mask wearing, recently endured one of the world's worst COVID outbreaks, end quote. Again, that the New York Times. I'm curious to know your thoughts with your background as well. This administration now working to appeal that, to get masks back on planes, back on buses. There are obviously a lot of opinions about this. What is yours?
Well, the key thing about masking is you have to wear them in order for them to work. And so when you see these rates in cities, it's because a lot of us, when we get together, we don't wear masks when we're with our friends and families around the dining room table. And frankly, that's where a lot of spread is occurring. When you're in contact with people and their air that they're breathing because it remains suspended in the air, then that can be a very real reason why it isn't really evident that masks are working well. But I know masks work well because I have worn them in multiple situations where people on either side of me were positive, and I have not become infected. And the 9 of us in my immediate household that have had to stay negative because we have vulnerable people in our household, we've upgraded our masks to make sure that they are working and they fit well. And so I still mask on airlines, but mandates should never be an excuse for not empowering the American people with the knowledge that they need to understand why masks work and why they should be used in certain situations. And I think sometimes we use mandates because we don't want to take the time to explain the science and the data and really have people understand who should be using them and why they should be using them.
And when you talk about mask wearing, I'm just curious in your own personal, your personal use, are you talking about N95 masks, or are you talking about just regular masks?
So great question. So when I'm in an indoor area where I don't have any control over who I'm going to be exposed to, I wear my full N95 mask. I put my hair up, it goes around my head. And so I utilize that. When I'm in social situations, meetings, and of course I'm working outside of the home, I use my KN95 that has a great fit, but just goes over my ears. And so I utilize the masking depending on what I perceive the risk to be. And I think that's what Americans need to know. What is their individual risk and where they should be masking or not be masking? I still think we haven't explained to them enough about how most transmission is occurring in friends and family gatherings around the dining room table. And if you need to protect an elderly or someone who has significant risk still for severe disease despite being vaccinated. Remember, a lot of people that were vaccinated were hospitalized and died during Omicron. So we really need to make sure that everyone knows and has the information to protect their household and their family members. And a lot of that has to do with testing. And if you don't want to test right before to make sure that you're not carrying the virus, then mask in front of your grandmother to protect them.
I want to ask you about that because I know you're someone that obviously follows the science, and that is your background. A lot of the CEOs of these airliners, as you well know, have pointed out that they believe that is the safest place to be in regards to the airflow and the filtration systems that have been implemented on these planes. Yet despite that, there is this appeal, again, to ask for masks back on planes. But I'm just curious to know, because you know that there is a farther reach. Once you put the mask mandates back out there, guess who's got to enforce it? It's your flight attendants again. It's your fights breaking out. There are after effects of this. So I'm just curious, do you feel safe on planes? Do you agree with some of these CEOs in regards to the science of it?
So the CEOs are right about when the airplane is hooked up to that exchange and they're doing those air exchanges like they do in the air. That airline is very safe. It's the issue, and I'm sure you all have boarded planes where the air conditioning is not working. It's 85 degrees back in the coach section. There's no air movement. Once you get up in the air, that's absolutely true. And this is why we get in trouble in our households, because you can't keep air exchanges at the rate of what airlines do. And so the CEOs are absolutely right. When you're in the air and that system is on, that is probably one of the safest air exchange and filtered areas that any of us could be in. It is the boarding process. It is that sitting in your seat and waiting for takeoff, and it's the off-boarding process.
Let me ask you before you go, because I'm out of time with you. I know you got to go, but I wanted to ask about your book. Tell me about that. What can folks learn from it, and where can they get it?
So great question, and thank you. What reason I wrote the book is to really show how innovative and how creative and how seriously many Americans took this pandemic to protect one another. And there's stories in there from universities that open, from tribal nations, from governors and mayors and communities that really worked together. They didn't close things. They worked together to keep things open, utilizing the tools that we have. And I'm just hoping we don't talk about the next pandemic, that we do what we need to do today to ensure that all Americans can survive. And there still is work to be done. And we're not getting the information that the American people need to have in order to protect themselves and their family.
Do you feel this Biden administration is handling this appropriately, this stage of the pandemic?
Well, you can look at the level of fatalities. We've had 175,000 Americans die since January 1st. We're clearly not succeeding. The UK had far fewer deaths during Delta and Omicron. We need to do better. We have the tools to do better, but you can't just talk in slogans. You actually have to support implementation on the ground and reach every American with the information, with the tests, with the treatment that they need, so they can too survive.
All right, Dr. Deborah Birx joining us live here on National Report. Good to see you, Dr. Birx, and we appreciate you taking the time for our viewers today.
Great to be with you.
All right.